a medium build upper body, and when we get down lower here, there's a lot more heaviness down just around the knee especially.
Oh my goodness. Wow. That is insane.
We just finished the second side, so yeah, come on up and let's take a look at things in the mirror.
Oh my goodness, looks really good.
Hi everybody, I'm Dr. Sue and I'm here with Christina. How you doing, Christina?
Good, how are you?
Well, welcome here. We're going to be doing a case of liposuction around the ankles, calves, and knees today. We call that our knee complex, which is this area, all the way down to our cankles, which is short for calf and ankle area. And Christina, can you tell us what having fat around these areas is been like in your life, and how it's restricted you?
It has seriously affected my self-confidence. I don't like to wear shorts or skirts or anything that shows my ankles. It's impossible to shop for boots because I can't zip them up around my calves and ankles. It's just, yeah, it's been very difficult.
So it's really restricted what you feel comfortable wearing?
Exactly.
Okay. And Christy and I were talking. Is it okay if I mention, what you've had done there before?
Sure.
Or why don't you tell the viewers, what your experience has been as far as, attempting to get this corrected in the past?
Sure. So I actually have had liposuction on my ankles before. The doctor, the way he explained it was he just wanted to do the cankles because if he did the calves too, you wouldn't really notice much of a difference. So it's just kind of an abrupt and not really complete liposuction. So there's still a lot of lumps and bulges, which I'm hoping to have corrected today.
We'll look at that in a second. Yeah, so you did a lot of research back then too, right? Yeah. And this was a little bit over 10 years ago?
2008 or 9, somewhere thereabouts.
Yeah, and the doctor said that they could do it and had some experience doing it. So anyways, for viewers out there, if you haven't started looking already for someone that can do this area, I think you're going to find when you do your search, there's very, very few doctors that have much experience in doing this. And I'm not going to go into a long explanation of why that is, but there's very few doctors that do this area and do it on a routine basis. Even finding someone that who is even willing to do it is hard to find. So anyways, my advice, make sure that you see results, because we correct a lot of things here in this practice, and you don't want to do things twice, okay? So make sure you find someone that has lots of results that they can show you, and so you can avoid getting into that issue. Anyways, can I show them what we have on you?
Yeah.
Okay?
Yeah.
All right, so see right here, Christina has, a medium build upper body, and when we get down lower here, there's a lot more heaviness down just around the knee especially. It's not terrible down around the ankles, but one of the things that is a giveaway to this is that she does have this cuffing, okay? So we have a little edge of fat that forms a little bit bigger ring around the ankles. And that's something that we really hope to make it go away completely today, but the skin may still have some memory on there. Anyways, the knees are going to make a huge difference on Christina, because you see how there's some thickness around there, and the legs look so much more beautiful when the leg tapers down smoothly into a nice small little knee. Can you turn around for us, Christina? Okay, and then we can see on the back, she has a lot of thickness over the calf area, and instead of seeing just larger size calves here, we're going to see a defined, slimmer appearing, toned calf muscle, okay? And then what we have here is a little shallowed area where the previous doctor took some fat pretty completely, but then left this lower area kind of full, so it looks like a bulge now. And we have it to the same on the right here and right there. In any case, I'm going to say that the doctor who did this probably didn't have much experience. Most don't. If they've done a few cases, they may tell you, oh yeah, I've done it before. You don't want to go to someone who's done it before, meaning just a couple of times their entire career. It takes a lot of experience to do something like this and do it well. So anyways, we'll be doing this wide awake. And what's cool is, Christine, you're going to be wide awake, and then we have a mirror like this in the room, and we'll be standing up to take a look at our results immediately after. The benefit of that is not just that you get to see it, but if we stand you up and we see a little bit that's still there, we can go right back in and take care of it. Some of these things don't show up that well until you do stand up and you have gravity, kind of pulling things downward and showing you what's there. So that's one of our big advantages to doing the weight. Okay, so you ready to take a look?
Yes.
Okay, come on right here.
All right.
Yeah, you can swing your legs over. Remember, stay on the pad right here. Okay.
Oh my goodness. Wow. That is insane.
You can turn all the way around so you can see the back sides of everything.
Wow.
Look over your other shoulder, it'll be easier.
Yeah, you're probably right. Oh my gosh. I actually have ankles. The backs of my knees.
You actually have a shape of a calf, right?
Yeah, I have calves and ankles.
Okay, I want you to go up on your tippy toe a little bit. You can just watch right there.
Yeah. Goodness.
Okay, now let's turn back around facing forward here. And let's see, did we get that? I think we got that little cuff. You see it any more? I don't see any remnant of that cuff.
I don't see it.
Okay, and then you can kind of lift your foot up and down, and not just like lift it up like this.
Oh, I see.
Yeah, and see, when you really pull it up, you see where it was.
Yeah.
It just barely wants to, kind of poke out at you, but when you're standing straight, I think we got it.
Yeah, even my knees and above my knees.
Especially your knees. Remember how I told you that, if you have a lot of thickness around the knees, it makes the whole leg look bulky. But if you slenderize it, you see how it all tapers down to, a nice shape around your knee?
Yes.
That's as thin as we could possibly get it.
That looks amazing.
And then if you do this right here, just bring your knee.
Oh yeah.
Bring it up front, okay, and then you see how it has some shape to it now?
Yeah, definitely does.
And you have a little bit of looseness right now, but that's going to tighten up overnight. Okay, thank you. Do you like it?
Yes, it looks, I can't even believe that it looks like that right now.
Okay, awesome, all right. Christine, you ready to get up and take a look? We just finished the second side, so come on up and let's take a look at things in the mirror.
Oh my goodness, that looks really good. I still can't believe I have normal looking legs.
Okay, they're normal now?
My calves and my ankles look pretty close to normal now.
Okay, let me see the back of them. All right, and let's see the front.
This is actually even better than I expected, if I'm being completely honest.
Okay, better than you expected?
Yes, better than I expected.
Yay! All right, awesome.
I can't wait to see them when they're fully healed.
Yeah, okay. So but you see how the skin's very tight also?
Yeah.
If you lay that down, you'll see a little looseness, but that's going to be very tight by tomorrow, so there's not any worry about skin issues. All right, so any last words? Or?
No, I'm thrilled.
Good. All right, I think you'll be confident wearing the clothes that you.
Yes.
Okay, that you haven't. Okay, great. All right, thanks a lot. Bye-bye, Christina.